The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to demonstrate how to transfer an individual from a bed to a bedside chair using a standing pivot technique with an assistive device. This technique may be useful for someone who has weakness in their legs or who may need some assistance with balance during the transfer. A wheeled walker will be used in this video, as it is one of the most common assistive devices used by older adults. This video assumes that you have already gathered any items that you may need, such as a gait belt, non-slip socks, and the assistive device prior to transferring the patient into a sitting position. It also assumes that you have already positioned the chair close to the bed prior to assisting the patient into sitting. For this transfer, the chair may be positioned a bit further away than it would be for the stand pivot transfer without an assistive device. The rationale for this is to allow the patient room to maneuver the assistive device. However, you still want to try to minimize the distance that the patient needs to travel to maximize the patient's safety. If your patient is known to be able to bear weight fairly well and can even ambulate, it may not be necessary to have the chair this close. However, the medical and therefore functional status of our patients can change. So if the patient's ability to complete the transfer successfully is in question, it will always be the most safe to have the chair as close as possible. This video starts with our patient already sitting at the edge of the bed with the gait belt already in place. Before having the patient stand, make sure her feet are flat on the floor, pulled under her, and are shoulder width apart, so that she has a stable base of support as she comes into standing. You may need to have the patient scoot forward to position her feet appropriately. Notice that I have the assistive device within reach. I have already gotten it close by before having the patient sit up, so that I don't have to leave her unattended on the bed while going to get the walker. Next, to help the patient stand, have her place both hands on the edge of the bed. She can reach for the hand grips of the walker as she assumes the standing position. Position yourself along the side of the patient opposite the chair so that you will not be in the way as the patient turns. You should hold onto the gait belt with the palm of your hand facing up. Instruct the patient to lean her trunk slightly forward and to push through her arms and feet to stand. Don't simply pull straight up. This is uncomfortable for the patient and increases your risk for back injury. Rather, you can use the hand that is on the gait belt to assist her in shifting her weight forward over her feet. Once the patient is standing, make sure that both of her hands are on the walker. You can also quickly assess how the patient is tolerating the upright position by asking her, observing her facial expressions, and feeling how steady she is. Have the patient take small steps to move her feet toward the chair. She should push through the walker as she moves her feet, as that is the function the walker serves, to take some of the weight off of the lower extremities and also assist with balance. She should also move the walker along with her, keeping her feet inside the walker as she turns. Move along with the patient as she turns, staying along her side and keeping one hand on the gait belt and the other hand near or lightly touching the trunk or assisting in moving the walker. You'll notice in the video that I switch sides in order to stay close to the patient but not get stuck between the patient and the bed. When the patient feels the back of both her legs touching the chair, have her reach back with one or both hands for the armrest of the chair as she slowly lowers to the sitting position. As you help the patient lower into sitting, you can squat down with your legs as the patient descends to help keep your back in a good position. Once the patient is sitting, move the walker out of the way. If needed, help the patient scoot back in the chair and remove the gait belt from her waist, or at least loosen it for comfort. Prior to initiating the transfer to the bedside chair, you should assess the patient's potential to tolerate the transfer once you have them sitting at the edge of the bed. It is best to remain close to the patient and even keep a hand on the patient's trunk while they are sitting so that you can feel if they need any assistance with their sitting balance. A patient who is struggling to sit will also have difficulty moving into a bedside chair. You should also be observing the patient for any signs of lightheadedness, since they likely will have just transferred into sitting from supine. You can also be asking the patient how they feel, as pain or nausea can intensify in the sitting versus the supine position. You can also consider conducting the egress test or ICU mobilization test to assess the patient's ability to bear weight prior to leaving the bedside. See the Capture Falls website for information on those assessment tools. If the patient has one leg that is stronger than the other, it might be helpful to have the individual pull the stronger leg back relative to the other one so that it is closer to the bed prior to standing. This position allows the stronger leg to raise the body most effectively to a standing position. Both feet should still be shoulder width apart. If the individual does not have one leg that is stronger than the other, positioning one foot posterior to the other is less important. But you should still ensure that both feet are shoulder width apart to maximize the patient's ability to balance once they are in standing. Also, when the patient is initiating the stand, you do not want to have the patient grab onto the walker with both hands and try to pull themselves up into standing. Because the walker is not anchored to the ground, it is not a stable item that can be used to effectively assist them into the standing position. A compromise would be to have the patient place one hand on the walker and push off of the bed with the other hand. Lastly, if the patient is going to remain in the chair after you leave the room, for fall risk reduction, ensure that personal items and a call light are within the patient's reach, and set a chair alarm if indicated for that patient. It would also be appropriate to remind the patient to call for assistance prior to getting up from the chair.